Hello, good evening, everyone, and welcome. Hopefully you're in the right place. Tonight we are having a webinar talking about perimenopause and menopause, navigating change in South Asian communities. My name is Camille Wilson, and I'm the founder of Menopause Made Modern, and we are an information, tips, and resources platform centering on the unique needs and stories of women of color navigating menopause transition. And I'm so pleased to be joined by Nishat Uddin, founder of Brown Girls Health, she focuses on providing information, health insights for South Asian women. And we have joined up for World Menopause Month to host this webinar, welcoming Dr. Hajira Yasmin. And we are so lucky to have her this evening. So we are recognizing World Menopause Month this month. And so we are very appreciative to Dr. Yasmin for joining us, making time to talk about this very important issue. So we are going to run through a presentation and certainly leave time for questions at the end. There are a number of folks who have joined us tonight, and we certainly want to make time for your questions at the end. But first, I do want to introduce Dr. Yasmin. She is a board certified OB-GYN with expertise in sexual medicine. Being an ASECT certified sexuality counselor and formerly the North American Menopause Society, now the Menopause Society, a certified menopause practitioner. And she has also obtained sexual medicine fellowship in women's health with the International Society for the Study of Women's Sexual Health. She specializes in treating perimenopause, menopause hormonal balance, sexual dysfunction in women, vulvovaginal disorders, including vulvovaginal pain, skin disorders of the vulva, and pelvic pain. She is also the founder of Alray Gynecology, Alray Direct Gynecology and Intimate Health Center. And so we're going to get started. You can check more out about Dr. Yasmin and her practice at Alray. We'll make sure you have that contact information at the end of the webinar. But I did want to call out this this quote that we're starting tonight with. It really was, I had the opportunity to interview Dr. Yasmin for my menopause blog about a year and a half ago, and was really inspired and motivated by her enthusiasm for bringing education and awareness to women, particularly women of color and communities of color, around menopause education and our overall health. And so I think we're going to, well, with that, just go ahead and get started. So Dr. Yasmin, let's see. I'm going to advance the slides for us tonight. So you just cue me whenever we're ready. But first we wanted to start with, what is menopause? There's a lot of confusion around what it is. Can you give us a definition of what menopause is and what it isn't?
Yeah, thank you for having me. I'm so delighted after a busy day that I'm going to sit down for the next hour and talk all about menopause, perimenopause, what are the symptoms, and what we can do to make this phase really healthy and joyful and peaceful, okay? So what is menopause? Menopause is the cessation, is the stoppage of your menstrual cycles. It means you are not having that monthly menstrual bleeding. And if you have 12 consecutive months, which means it starts from January to like about March or February of next year. So it is going to be 12 consecutive months of no bleeding, like no, even a day of spotting or a day of like light bleeding. Many women come to me and ask me, okay, I just had like 6 months of no cycles, but then I got it like at the end of 6 months, one cycle. The countdown restarts again. So it has to be 12 consecutive months of no bleeding, and that is called menopause. Average age of menopause in United States and in the Western world is about 51. And why do I say that on the Western side of the world? Because there is a huge variation in this age of menopause. In India and Bangladesh and Pakistan and Southeast Asia, that's the whole Southeast Asia, the age can be anywhere from 45 to 47. Now, mind you, these women are going through menopause a lot earlier than 51 years of age. So we got to be very mindful and not just read what is there on the internet, what is there in your textbooks to say, okay, my menopause is going to come like 51, 52, 55. No, it depends on your ethnicity, on your culture, in your environment, and a lot of other things that determines what age your cycles are going to stop. Now, the Black Americans or the Black race goes into menopause like about 49. They go at 49. The Southeast Asians can go anywhere between 45 to 47. And the Caucasians and the people on the Western world with their genetic race can go in menopause at 51. That's an average age. Mind you, that's an average age. I've seen patients who can go in menopause even at 55. So they can continue to have cycles. So the middle part of the bell curve is 51, but they can be women at 55. And then we can also have women at 45 or even 40 years of age. So it's a different type of menopause, which means early menopause, premature menopause, or we call that as late menopause beyond 51, which can be 55. So it's all very variable. I don't want you all to leave this lecture thinking that, oh, it has to be 51. There's nothing fixed about that age of 51. Next slide, please. Now, what are the different stages of female reproductive life? Okay, so what does that mean? Reproduction, we think that the cycles are coming in every month. So you start your first cycle when you're like about 12 years age, 13 years of age. Again, highly, highly dependent on the area of the world that you live in, the diet that you're exposed to, the environment that you're exposed to. The first cycle that a woman or a girl gets is called the menarche. So the menarche, the first stage of your fertility, begins after a few cycles between that 13 to 17. So your fertility begins like 18, 19, 20 years of age, and you can go into fertility and pregnancy and conceptions and all the good stuff that happens in life with creating another human beings in this world, creating babies, creating fertility, maintaining your fertility can happen up to 35. Again, that's an average age. That is called premenopause. We typically don't use this term very often in OB-GYN because we don't want to label our fertility patients or the young ones as premenopause. We call them as fertile phase. And then we jump into perimenopause. And what does perimenopause mean? It is just a phase around menopause. Peri is around, and it's menopause. When does menopause happen? Okay, it's one day. One day you get your badge of honor. And what does that mean? You have completed 12 months of no cycles. But the time before that, it can begin at 35, it can begin at 40 years of age, or it can begin anywhere between 40 to 51 or 40 to 55. And that is called perimenopause. Now, once you get that menopause label, which is just one day, like, okay, today is the day I'm going to mark in my calendar that I got this cycle. And today's been like 12 months of no cycle. And my last cycle was 12 months ago. Beyond that, if you are in that phase for about a year, you become postmenopausal. So it's just, I would begin as fertility phase or premenopause. Then I would go to the second stage of perimenopause, which can last between 7 years, 10 years, 15 years, depending on where you are and what your body is doing. And then postmenopause is a very interesting phase. Many patients come to me and say, oh my God, I'm postmenopausal. I think I'm done with this menopause and this is the end of it, so I don't have to worry about it. But you live in postmenopause. The rest of our lives, which could be half of our lives, if you went in menopause at 50 and you lived till 100, half of your life. If you went in menopause at 47 and lived till 67, so about 1/3 of your life or half of your life, you live in menopause. So menopause does not escape from your body. That phase, you're never able to come out till the end of your life. Till the expiration of the lifespan that we have, we all live in postmenopause. Okay? So next slide, please. Now, what is Go ahead.
You spoke to, I think, premenopause, I think pretty succinctly. So I do want to move to the next slide and talk. You talked to us also about perimenopause being the time around menopause, right? Can last. Can you talk a little bit more about the duration of perimenopause, how many years it can last? We'll
Yes,
talk a little
absolutely.
bit later about the range of symptoms, but when we talk about menopause transition, you're clarifying for us, you're likely either perimenopausal or postmenopausal experiencing symptoms since menopause is one day. So talk
Yes.
a little bit more about what perimenopause can look like for women.
Yes, perimenopause is a very, very important phase. If you ask me as a gynecologist, I would say the whole thing in your body, including your mind, your entire systems, your cardiac system, your heart, your brain, your metabolism, your genitourinary system, everything changes in perimenopause. Like I described, those are the years leading to menopause. And it can last for some people 2 years. They could be having regular cycles till 47, 48, no symptoms at all. In 2 years, they are in menopause. For some people, it can last for 10 years. Average is about 5 to 7 years. So if you go in menopause at 51, usually like 42 onwards is perimenopause. Classical perimenopause duration is about 5 to 7 years. But I am seeing more and more gynecologists like me are seeing perimenopause beginning at 35, beginning at 38. It can even happen, there are outliers where perimenopause is starting right after that fertility ends, which means you had your pregnancy, you had your baby, you still kind of finished your lactation, you're nursing, everything. 2 to 3 years down the line, you're like, okay, I'm getting these hot flashes. My anxiety, my depression, my mood swings are out. My sleep is disturbed. And we'll just go through the different symptoms that we face in perimenopause. So all these symptoms, they can come into your body and you can show up with these symptoms, and women dismiss this thinking, oh, and when you go to doctor, more than patients, I think is the doctors too, when you go to them and report that you're having these symptoms, we look at you and we say, oh my gosh, she's only 38 years old. And what is she talking about perimenopause? You know why that happens? Because we were never trained in perimenopause. We as OB-GYNs and internal medicine, family medicine, we got different specialties in our country here. We were never trained about perimenopause. We were focused only on postmenopause and menopause phase, whereas peri, or the years leading up to the menopause, is the most important phase in a woman's life, because this is where we can place huge amount of life changes. We can do behavior changes. We can change the way you live. We can change the way you sleep, the way you eat. We can bring about a lot of changes that are very, very proactive, and they are preventative for major illnesses that you can face in menopause. And those changes that can happen in perimenopause should be discussed. These are the conversations that we need to start in this phase, and that's why it's an important phase. Like it can be like for like a few months. We have written on the slide a few months. I very rarely see people in perimenopause in a few months. We see at least 1 to 2 years, and then we see like 10 years. So there is a variation between 2 years to 10 years, or sometimes women can have even 12 years. For women who are going in menopause at 55, They could be in perimenopause from 42 to 54. So it can be more than 10 years. So it all depends on to how your body is slowing down. And what happens in perimenopause? Why are we so worried about? Why are we facing these symptoms? Why is it happening to us? It's the physiology, it's your biology that is changing in your ovaries. Your ovary makes 3 hormones, and I can talk an hour on these hormones, but I don't think Camille is going to give me that much of a time. So, but I'll briefly touch on what hormones are changing in perimenopause. Now, remember, if there is one thing that you have to take out from this hour, this is important. Your body makes 3 hormones: estrogen, progesterone, and testosterone. Okay. We used to think testosterone is mainly a male hormone, but it is coming more and more into play. And we are finding that women also need some amount of testosterone. They don't need as high as what we see in the blood circulation of a male, but we need some amount of testosterone. I won't get into the nitty-gritty, how much do we need and how do we give and all of that. But in perimenopause, the first hormone to go down, because you're not making an egg every cycle, is your progesterone. The progesterone is going down, and it is not doing that synchrony, that dance of high estrogen in the first half of the cycle, high progesterone in the second half of that cycle. That is a beautiful physiological dance that happens in your body when you're fertile. When you're fertile and you're making an egg, you're getting pregnant, you're having your babies, that is a beautiful biology that's running in your system. As soon as you hit perimenopause, something is breaking down in the biology of our ovaries. So the estrogen keeps going higher and higher and higher, and the progesterone is falling. So you are going to see a change in your cycle. Patients will come and tell me, oh my God, my cycle is shorter. I'm bleeding in 2 weeks. I'm bleeding in like 3 weeks, or I'm skipping a cycle. I'm not getting a cycle this month. Like, okay, October, I didn't get a cycle. My last cycle was September. And then I got it before that 2 months ago. So there is not a pattern of monthly bleeding that you were used to from the age of 15 or 18 or whatever stage it happened in your life. So my takeaway from this is, in perimenopause, the first sign that you're going to see is your change in your menstrual cycle pattern. And it is very, very important for you to track that along with what are the symptoms you're feeling. Okay. Next slide, please.
Before we leave this, a question that I know a lot of women have is it possible to get pregnant in perimenopause when you're in perimenopause?
Yes, 100%, 100%. And how do I say that? Because in perimenopause, now remember, progesterone is going down, but it doesn't mean every cycle you're not ovulating. It is a very erratic ovulation that can happen in perimenopause. You may be ovulating in month 1, but you may not be ovulating in month 2 and 3, but you may ovulate again in month 4. So perimenopause is definitely a phase where there is a potential for ovulation, which means you're going to release an egg. And if that window of that egg being in your body, then you put in a sperm there, you are going to get pregnant. If you are sexually active without birth control or contraception, perimenopause is a huge possibility for pregnancy, but you just cannot predict if you're having very irregular cycles.
Great. Thank you for that.
You're welcome.
So post-menopause, women think, oh, menopause, when is it going to be over? Can you talk to us a little bit about why we should reframe that thinking and what happens post-menopause?
Yes. I kind of alluded to this topic when I started, because this is a very common myth that I have seen in women. And this is all across the world. It's not just here on the Western side of the world, but it is everywhere. Like women, you meet them and they're like, oh my God, I'm having hot flashes, night sweats, I'm not sleeping well. I just want this phase to be over. Okay. That is a myth, and it is misinformation. You're never going to be out of menopause, which means Your ovaries stopped making those 3 hormones, okay? In the 21st century, we have the luxury of a great health. We have the luxury of so many things. And our average life expectancy is 88 years old here in the United States, okay? It's the same around the world. Women are living longer. We are going to live up to 90, 85, 75. So the age between 51, if that's the age of menopause that you went in, till 90 is postmenopause phase. It is going to be postmenopause, but you're not going to have severe symptoms like hot flashes or night sweats or many of those, but there are silent changes happening in your body. And we'll discuss that as we go along these slides. There are silent changes like your brain is changing, your heart is changing, your blood sugars are changing, your bones are changing, and your vagina is changing. Everything from, I always tell my patients, right from the top of your brain, like from your head to your toe, everything is changing. You know what you're not noticing in menopause is the hot flashes are like, oh, it's gone. It's all over. I don't have terrible hot flashes like the way I had in 50. So the bottom line is we live in postmenopause for the rest of our lives once the ovarian menstrual cycles have stopped. Next slide, please.
Thank you. Thank you. So I'm going to turn it over to Nishat, and she's going to take us through the next few slides. But this is what you've started to talk to us a little bit about. So Nishat, why don't you go ahead and take it over for us?
Yes, thank you, Camille. And I know, Dr. Yasmin, you've kind of mentioned this throughout too, and you mentioned that there's a lot of changes in our body. So, I know some are more common than others, but it can be a little different per person. But if you'd like to speak a little bit more to the symptoms and what women
Sure.
can expect.
Yes. So the main thing, before I list these symptoms, I want every woman who listens to this webinar, wherever in the world you are, please do not dismiss these symptoms. Please go to the provider, even if the providers, some of them are not trained in menopause, okay? 80% of the providers are not trained in the United States. They're the same situation is all around the world. Please keep asking them to look at your symptoms, be repetitive, be persistent, ask for a second opinion. If they cannot help you, you ask them, because that is the only way you are going to lay a very strong foundation for a healthful life in menopause. Because all these symptoms that we have listed here, not everybody experiences this. They may be severe symptoms of hot flashes and night sweats in certain races. They may be vaginal itching and urinary symptoms of leakage in another race. And some women may say, I got body pains. They don't know how to describe this. So education is so important. I want you all to read these symptoms, identify if that is happening in your body and your mind, because the Black Americans experience hot flashes and night sweats worse. The severity of these symptoms are worse in Black Americans. They're very mild in the Japanese and the Chinese. Indians, which is the Bangladesh and India and Pakistan, these people also experience hot flashes and night sweats, but they're not as severe. They will last for about 1 to 2 years. The perimenopause phase is very short in Southeast Asians, and they stop the cycles by 45 or 47. Now, some women are not able to explain what is happening to them. They may say, I'm having fever, or I'm having fatigue, like low energy, I'm very tired, or I'm just having body pains and joint pains and muscle pains. So listen to your body, see what is happening to you. And these symptoms can start, like I said, right from your brain to your foot. So what are the brain symptoms that you can have? Hot flashes, night sweats, low energy, mood symptoms. You didn't have anxiety, or you didn't have depression, or you had something which were very well controlled by medications. You were just taking a tiny little dose of a medication, but as soon as you entered perimenopause, you're like, oh my God, like what happened? Can I go back to that previous slide, please? Yeah. So I think, yeah, that one. Yeah, I'll stay on that for another minute and then we'll move. So you may feel the depression and anxiety is flaring up in perimenopause and menopause. You may also have vaginal dryness. Like, I get patients coming in with itching, urinary leakage. You may present with different symptoms in different parts of the body. You may have hair loss. Your skin may change. It may be oily or it may get too dry, and you may feel like, what is happening to my skin? And my skincare routines are the same. You may get dry nails. You may have dizziness. I have patients who come to me and say, like, I have diarrhea for no reason. I get up in the middle of the night, I'm sweating away like anything, and then I have to have a bowel movement in the middle of the night. Digestive problems, and all these are happening because there is certain changes, some autonomic changes that are happening in your gut, and it causes bloating. It can cause like body odor. It can cause burning mouth syndrome. It can cause gum problems. So we tell women to go and see the dentist pretty often around that 40 to 50 years of age, because gingivitis, which is inflammation of your gums, can happen at that time. Tooth decay can happen at that time. Tingling, nerve problems, which means your hands and feet are having issues with the small nerves that are present, palpitations, anything that makes you feel like, I never had this feeling my heartbeat and I'm feeling that all the time. What's going on with me? Osteoporosis is something like thinning and loss of bone density. We don't see that as a symptom, but you're going to have like bone pain. You're not able to lift things. You were able to run. You were able to do a lot more things with your muscle and your joints. And you're starting to feel that your muscle and your joints are getting weak. You're not able to do the things that you were doing. So all these symptoms, they fit in the conundrum of perimenopause and menopause. Some of the books actually mention 50 symptoms. I mean, we have told you all 33 to 34, but if you keep looking at the literature and keep looking at the papers, some symptoms are like 50 symptoms, okay? Let's go to the next slide, please. So does menopause affect South Asian women differently? I kind of, again, kind of discussed this a little bit, and I'm telling you, yes, it does, because it's your lifestyle. It's the diet that you're exposed to. It's the environment that you're exposed to. What are the toxins that you're exposed to? And what is the genetic factor? Like your mother went in menopause at like 40 years of age. Do you think that is going to affect you? Yes. There is a little bit of genetic passing from your mom and your ancestors that can come into you. If your mother went in early menopause, it is possible that you may go in early menopause. As I said, India, Pakistan, and Bangladesh, these women go in menopause like 45 to 47. And here in Caucasian world, they go in menopause at 51. The Black Americans go in menopause like about 49. And Native Americans and Blacks had severe hot flashes and night sweats. It can last longer. What does severe hot flashes mean? That means you're having 7 hot flashes in a day. You get labeled as severe. I get patients who will sit with a little fan at their workplace. They will walk around with a little hand fan in their hands. Why is that happening? This woman is suffering with severe hot flashes. That is happening because your brain is sensing there is fluctuations of estrogen. That your estrogen hormone, which is a primary hormone that is coming out of your ovary, is making your hypothalamus sensitive to make you feel like you are having a warm sensation. All the blood vessels in your body are dilating and you're sweating a lot. And you're feeling, once you finish the sweating, some women will also feel extreme chills. You're like, okay, oh my God, I was like sweated out and now I'm like shivering. That is also a part of hormonal fluctuations that is affecting your brain. Now, women don't seek treatment for this in Southeast Asia or even anywhere, any part of the world. I mean, I really put that as every woman is hesitant to seek treatment. Doesn't matter which part of the world you are. Because for a few things. One is we are pretty much a very resilient race as a woman. We are a mother. We take care of 100 different things. We are multitaskers. We are tough. So what we do is we just ignore it. We take care of our children. We take care of our families. We are caretakers for our mom and dad, but we are not looking at ourselves. We are supposed to be. We are supposed to be strong, and we are supposed to be the givers. We are the nurturers. We are taking care of the world. So how can I go and ask for help? So and you also look back and you look at your mother, you look at your grandmother, and you think, this is physiological. This is biology that's changing in me. I should be able to put up with this by taking a couple vitamins and a couple of supplements, and I should be fine. That is not the view for today. We have options. We have found out with science there is a lot more risk for you in the future if these symptoms are weighing you down in perimenopause and menopause. We got to start these conversations in perimenopause and menopause and not be embarrassed, not be put down by cultural taboos or shame or stigma. My mother never spoke about menopause to me. Honestly, my mother never spoke about menopause. I bet 99% of the mothers never spoke about menopause, or they never talked about sexual health, never talked about vaginal dryness, never talked about painful sex. So women in Southeast Asia are thinking, I never heard that. What's the point in me going and asking about that to the doctor? But guess what? Your menopause is very different than what your mother had. Your life in today's 21st century is very different because you're exposed to more challenges, both from your everything. Look at the world around you. I always tell my patients, look at the challenges you're facing today compared to what your ancestors did. Life was much more simple in that past. Today, we are caretakers. We are taking care of our children. We're taking care of our parents. We have a very demanding job. We have a lot more stressors, and we are getting exposed to a lot of environmental toxins. There are a lot of stuff in what we eat, what we do. Our jobs have changed. They've become more sedentary. How many of you are sitting at a desk 40 hours, 50 hours a week, high demanding jobs on the computer? Movement has reduced. How much of anxiety and depression, why is that going up? Why are women struggling with all these symptoms today when the ancestors did not open their mouth? Because that era was very different than where we are today. So I want every South Asian woman to really look at her body and ask for help. Don't try to put up with that just because historically that's been the taboo, a stigma to talk about aging, talk about menopause, talk about postmenopause, talk about low libido, sexual pain, vaginal dryness, mood swings. I feel very anxious, irritable, frustrated. I don't want to do this. Yes, it's okay to talk. Because the more you talk, there are two things that will happen. You will change the way healthcare is delivered. Second, you're going to allow research to come in and look at the problems that we are facing. 99% of the research was done, and there were huge studies like SWAN study, a lot of WHI study. All these studies were done in women in the Western world. We don't have too many studies in the South Asian women. We don't even know what menopause looks like because we don't talk about it. And hence, cultural taboos, societal stigma, anything, any pressure that you have faced so far, we got to get out of that and start talking and really looking for answers that our body is showing us as to why this problem is coming. I practice gynecology with the principle that bodies don't lie. If you come to my office and see me for a symptom, I would never dismiss that person. I would never feel that this person is telling something out of their mind. This woman walked into my office to tell that she's struggling with certain concern is because she's really hurting. She cannot live her life. That's affecting her quality of life. You need to look for a provider like that who really can understand you, who can understand your mind, who can understand your body, and really give you the options. You don't need to take any treatment, but you need to listen to what options you have at that point in your life. So it's only you who can break these taboos. It's only you who can wipe out these stigmas. So I want South Asian women, any ethnicity, Black women, Hispanic women, Latino women, to stand up and really ask for help. Okay. Next slide, please. Now, how do we manage menopause transition? This is pretty much, it's like a whole day lecture put in one slide. So we could each, Camille and Nishat could actually prepare one thing for like 2 hours. We could talk about protein, nutrient-rich diet, exercise, hydration, sleep hygiene, manage your stress and MHT or hormonal treatment, non-hormonal medications and supplements. Each of this, I actually tell menopause like a chessboard, okay? So perimenopause and menopause is like pieces of chess. You cannot overwork one thing and neglect the other thing. You need everything to fall in place to achieve that wellness in that transition. You can't tell me that you're going to take hormone therapy and you're going to shoot out all the other things like your diet, your sleep, your exercise, and your stress, and you're going to have a great menopause transition and you're going to avoid all the risk factors in your life or all the chronic illnesses. That's not going to happen. That's not going to happen because this is not this is not an illness. This is not a disease. Menopause is not a disease. It's a physiological change that nature is giving to women. And it is asking us, you know what? I'm going to give you 40 years in your life. You're going to live beyond 50. You're going to live up to 90. So what are you going to do in those 4 decades of your life? I'm going to put hormones if I decide to put hormones in my body that have disappeared. Okay, that's your menopause hormone treatment. If you are the right candidate for hormone therapy, yes, we're going to put those hormones. You're going low on your estrogen, your progesterone, your testosterone. Okay, we're going to give you that. And if you decide, I'm not going to use hormones, that's not for me, but I want to know what are my options for non-hormonal medications because I'm having hot flashes, I can't sleep, I'm sweating all the time, I'm like wet in my PJs, and I don't have libido, I don't have sex drive, my vagina is hurting, I'm losing a lot of urine, I'm sneezing, I'm coughing, and you take your concerns and you ask for options. Okay, I want to try hormones, I don't want to try hormones, or I'm going to go for supplements. I'm going to manage stress and your sleep because the foundation pillar of wellness is sleep. I attribute a huge amount of weightage for sleep in my practice. I always tell my patients, if you can sleep well, you can restore majority of the symptoms that are going on with you, like fatigue, irritability, anxiety, depression, brain fog. You're actually not allowing that brain to degenerate and expose your risk to something like cognitive decline. And what is cognitive decline? Memory loss, dementia, Alzheimer's. Everything can be prevented if you can prioritize your sleep in perimenopause and menopause.
So
Nobody can. Go ahead.
Dr. Yasmin, we did advertise 45 minutes. And so for the women who can only stay on for a few more minutes, I think, Nishat, if you can stay on till 8:30, I can stay on till 8:30. And Dr. Yasmin, we'd be glad to have you. But I did want to just check in and see if we had any questions. If from anybody who might have to jump off, if they want to put them in the chat. So I'm going to stop sharing.
Yeah, sure. I think I'm seeing a question here which says, does managing these symptoms improve quality of life during peri, post, and both peri and post-menopause? As in, does your experience in perimenopause affect post-menopause if left unmanaged? Yeah, I'm not getting that very clearly, but I'm going to try and answer as best as I can, okay? It says, managing these symptoms improve quality of life. Yes, it does improve quality of life because if you're struggling with hot flashes, night sweats, lack of sleep, and mood swings, it does improve quality of life. And does experience in perimenopause affect post-menopause if left unmanaged? Yes, we are finding more and more data that is coming out that increases your risk of cognitive decline, increases cardiovascular disease, increases your risk of diabetes, and also osteoporosis. So we are going to manage your post-menopause phase in a much better manner if we can help you pivot your lifestyle, your behavior changes, and whether you decide to use hormone therapy or not. It has a huge impact in post-menopause. I hope that answered your question. So the next one is, what do you recommend if you have trouble falling asleep? Oh, that's a very loaded question. So it really goes on, what is the problem that you're facing? So we go back to the root cause of why you're not sleeping. We look at your entire health history. We look at what is causing you not to sleep. Is it the hormonal deficiency? Is it something to do with your thyroid? Are you struggling with something in your body? We got to really, really dive deeper into the cause of insomnia. We call that as lack of sleep, or staying asleep, or falling asleep. Or are you having nightmares? Do you have hot flashes? Do you have a very busy mind in the middle of the night? What exactly is causing that? Okay, so based on that, yes, there are lots of recommendations, but we can't do like a generalized stuff. We just tell you to follow sleep hygiene. And I bet you have heard about sleep hygiene is to get into the same consistent time into your bed and, wake up at the same time, turn off the blue lights, not like till 8:15. If you go to bed at 8:30, don't sit on the Zoom webinar and try to jump into your bed at 8:30, so you're not going to be falling asleep. And expose your face or your eyes to sunlight sometime in the middle of the day, so it helps your melatonin production as well. So there are a lot of tips that will help you fall asleep. What are some of the supplements you typically recommend for hot flashes, low libido, and mood changes? Again, that's very, very specific for hot flashes. Now, why do we not prescribe supplements, either here United States or anywhere in the world? Is because we don't know if these supplements will act uniformly in every woman. That's why the FDA does not approve supplements for doctors or any prescribers to give that, because we don't know which one works. So it's a huge market. It's $1 billion market for menopause supplements. Okay, all over the world. So if you go and look for hot flashes, the grocery stores, the drug stores are flooded with supplements. We don't know which one works, but there are some small studies that have shown there are certain supplements that work, but we don't know whether it works in everybody. So people use like isoflavones or soy products. And low libido is, again, something that's very complex, and it is linked with your brain, with your psychology, with your biology, and we have to dive deeper to really recommend on that. Mood changes, again, very much typical about, is it anxiety? Is it depression? What is the mood that you're experiencing? Is it irritability, or is it lack of sleep? And is all of these things causing some form of outcome in your body? So based on what is the reason, we come up with a supplement list for you. And I typically, this is in my practice, I don't recommend supplements beyond 6 months. I tell my patients, don't waste your money beyond 6 months. 3 to 6 months, if that is not working for you, it's not going to do anything. Just don't keep throwing your money and your resources away, because supplements will show the effect in about 6 months, in about 4 months. Some people will tell me in 3 months they found some difference, the hot flashes were better, and it's probably working for them. Okay. Awesome.
Great.
Anything
Yeah,
else?
the next one is, what are your recommendations for vaginal dryness?
Yes, vaginal dryness is mainly happening because of lack of moisture and lack of elasticity, and in your vagina, like your skin of the vagina is as sensitive as your skin of your face, or even much more sensitive. So I would say vaginal dryness, there are a bunch of vaginal moisturizers present. I would go in and choose what is best for you, something like aloe-based. Don't try something which are like a drugstore brand. Take something organic, aloe-based vaginal moisturizers. Now, they could be dryness during sex, and there could be dryness during non-sexual times, like you're biking, you're walking, you're exercising. So there are lubricants. The ones that we use during sex are called lubricants. The ones that we use non-sexual are called moisturizers. So I would definitely look for an organic brand that has very minimal products in that, like glycerine and petrolatum products, anything that looks very clean. My favorite brands are a couple of them, but the one I recommend is Good Clean Love. I really like that, and my patients like that. Anything with aloe-based is also clean, and we get that here in the United States. So I do recommend that. So, but if vaginal dryness does not go away with any of these non-hormonal medications, then the main thing is vaginal estrogen. Vaginal estrogen is a very, very low risk medication. We have not found a huge amount of absorption of vaginal estrogen from your vaginal skin into your body. So if you are still struggling in spite of using these non-hormonal options, I would recommend you to see a gynecologist or your clinician to prescribe you vaginal estrogen. What in our South Asian diets are beneficial in supporting us in post-menopause? Magnesium, turmeric, certain spices, and plant-based items. Yeah, I like those because many of them are antioxidants, and turmeric is supposed to be a very, very good cancer-preventing medication or supplement, or even like, it's coming up in little capsules, and people put a lot of turmeric in South Asian diets. And spices too, majority of those, like the cardamoms and the clove and all these things, are important. They are an antioxidant, so you can definitely use that. And plant-based diet is an amazing diet, again, because we don't have that much of a damage of our cell system in our biology, in our bodies. So a plant-based diet, I don't say vegan, but I say, yes, a lot of plant-based items reduce the intensity of menopausal symptoms. Magnesium is a big thing because it does relax your brain, and you can take that at night, and it helps you sleep as well. So magnesium is an important mineral that I would definitely incorporate in your diet or even as a supplement. I just turned 47. I had chemotherapy in July for a week for hairy cell leukemia. I guess that put me in early menopause. I've been telling my PCP, OB-GYN, a couple specialists, endocrinologists, I feel like I'm being dismissed. Yes, it breaks my heart to hear this, and I hear this every day until, as long as I'm alive in this world, I will stand on the top of the hill and tell everybody, you cannot be dismissed. If you are dismissed, there are providers in this country and everywhere in the world for you to find that who can help you. And we are going to give you some resources. There's something called the Menopause Society here in the United States. You can go on those and look at the directory who is trained by the North American Menopause Society. They call themselves as Menopause Society now. And we have to pass an exam because the training was not there. Endocrinologist, no, absolutely no training. Primary care doctor, no. OB-GYNs, I will tell you, with my training across the world, I trained in India, I trained in England, and I trained in United States. Across the world, there's no menopause training, nowhere for medical students or OB-GYN residencies. We are trying to change that now. 20 years from now, 10 years from now, we may get better attendings or better consultants coming out, trained in menopause medicine. But what you are facing, people who are existing in current practices, you may be dismissed. 80% of patients get dismissed, 20% find the right provider. But if you go on the Menopause Society directory, there are providers like me and many of them who pass an exam and who kind of study menopause medicine, and they're able to listen to you. They're able to understand your body, what is going through, and really give you the options how to help you. So I would say find a provider in your zip code, in your directory, in that area, and they should be able to help you.
That's wonderful. That's great. It looked like that you got through all of the questions in the Q&A. So that's great. We still have a few people that are still on, and we had just 2 more slides to get through. So I'm going to go back to those because those speak to, I think, tips for getting support and for resources. So
absolutely.
Okay.
So
Okay.
can you hear me?
Yes. Yes.
Yes.
Yes, great.
Yeah.
Okay. So for a better menopause experience, I would say track your symptoms. Okay. It's okay to take a little journal. I always tell my patients, take a little small book or the ones that come like a little bounded books or any calendar, any journal, any diary, or anything. You track your symptoms. The first symptom, okay, my cycle changed. What happened? What happened to my brain? I was feeling this way. It's okay if you overdo it. It's okay if you overwrite it, because once you look back in 12 months or 6 months, and when you go to your provider, you will be able to highlight these symptoms. You will be able to tell your clinician what is wrong with my body and why I think you need to look at me because this is happening with me. You are your best advocate. If you go to the doctor and they're not listening and you have this whole journal full of symptoms that you are struggling and you are suffering, there will be very few providers who will dismiss you. So tracking your symptoms is very important for these reasons. And I would say always track your symptoms now that you're hearing more about perimenopause and menopause. Like I said, don't be afraid to ask treatment. What is the worst thing that they're going to tell you? No, you're too young to be in perimenopause, or you're too young to be in menopause. You don't need treatment. You're too high risk for treatment. Though if you personally feel, no, I don't feel comfortable with that decision, be persistent, do your research, go back to the provider and say, I did my research. This is what I found. What is your opinion about that? If they still dismiss you, look for a second opinion. Look for a provider who aligns and listens to you, who validates you, and who will come up with an answer for you and give you a solution. Because we as clinicians, we are trained to alleviate human suffering. Why am I sitting here at 8:23 p.m. after a busy clinic to talk to y'all? Because my job is to alleviate the suffering of women. My job is somebody is going to listen to this webinar and go and talk to their doctor about saying, Dr. Yaz told this, and this is happening to me. These are my symptoms in the last 6 months. I want you to help me. And if you can't help me, please refer me to a menopause specialist. Okay? Because when doctors sometimes are lost because they're not trained, the general practitioner, the internal medicine, the endocrinologist are amazing in thyroid and diabetes, but they're not trained in ovarian hormones. And I'm sorry to say, but it's going to change in the future. When they are not trained how to treat menopause, they may just tell you, it's okay. You're gone past menopause now. Hot flashes are gone. Don't worry about it. No, you got more knowledge. You advocate for yourself and say, can you refer me to a menopause specialist? Or you look for a menopause specialist who understands menopause, who is certified in menopause, who has passed an exam. Because you don't just pass an exam and finish it off, because as a menopause specialist, we got to be up to date with everything. We attend the meetings, we go to the NAMS meetings, we go to the sexual health meetings, and we pass an exam every 3 years to be certified. Then you find your community, wherever you're living in this world, or whichever part of the country you're living in the United States, find a safe community. Like it could be your friends, it could be your neighbors, it could be a workplace. Find a community to talk in a safe space. This is happening to me. How do you navigate this? What are you doing? It's just like when you were pregnant with your little babies and you had these mothers together. You would go with your little kids and share the joys and sorrows of pregnancy and post-pregnancy and how you're raising your kids. We need to have menopause cafes. And I am a huge advocate for support groups and menopause talking groups so that you're not alone. You have a whole tribe with you. You can talk about it. You can see what that person, how she's navigating what she's experiencing. And you can relate to what is happening to you as something that happens to everyone. It's physiological, and you don't have to be afraid to ask for questions or ask for answers for the problems that you're experiencing. Okay. Next slide, please. So this is a wonderful resource that we have put together. So Menomade Modern is Camille and Nishat are putting out a lot of info there. I mean, I'm there on Instagram. I used to come on and talk a lot, but you know, I spend 10-hour days in the clinic and I see so many women. And sometimes by the time I finish my clinic, it's so long, I don't have time to come and talk like the live talk I'm doing right now. But there are a lot of other doctors who just do education. They're not heavy on the clinical practice, but you know, when they come on and talk, I want you all to listen, like the National Menopause Foundation, the SWAN study. The SWAN study is a 1994 study that was done in America, where they looked at all the women's health in midlife and menopause and what happened to women. Like somebody was asking me the question, that was an excellent question. They asked, like, what is the outcome in postmenopause about the symptoms you're experiencing today? That is a great question. The symptoms that you're experiencing in perimenopause and menopause, what does it do to your life? That SWAN study has got facts on the website. It will tell you every symptom and what you can do and how it can impact your life in the future. So, but if you want to see a certified menopause specialist and you don't find anybody, like you go to your regular clinicians and they're dismissing you, you can go to that menopause.org. That's the Menopause Society, which actually administers that exam every 3 years and certification for people like us. And you can find a provider in your place. I practice in 2 states, in Wisconsin and now North Carolina, so I can see you as my patient and really treat you and keep you as a part of my practice in these 2 states. But I do consultations for women who want to know what is their specific scenario. This is exactly what is happening to me. I need to do this for myself and I'm not getting help and I'm getting lost. You can always have an educational consultation with me from anywhere in the world. It doesn't have to be United States. It can be anywhere in the world. I talk to people all the time to tell you specifically with your scenarios, how can you seek help, okay? So you can follow me on Instagram too. I try to put out as much as I can on dryas.alraymd, and I'll be happy to answer any of your questions, okay? And if you want to make an appointment with me, you can go on my website. My website is right there, alraymd.com, and send me a contact form or anything and say, I want to see you as my doctor, as my gynecologist, as my menopause specialist, or I also treat a lot of vulva pain and sexual health disorders, like Camille was mentioning, anything from low libido to painful sex to lichen sclerosis, anything that is bothering your vulva, vagina, anything, pelvic pain, I treat that. So I'm happy to take care of you if you come as my patient. Thank you so much.
Thank you so much, Dr. Yaz. Nishat, do you want to take us out, close us out by reading this last comment in the chat? Can you see that?
Yes, absolutely. So we have a wonderful comment in here, and I just first want to say thank you so much, Dr. Yasmin, for your time today and the wonderful presentation, and echoed by our audience. We had a wonderful comment that said, wow, you are an excellent speaker and phenomenal educator. I am inspired and feel better prepared for this stage of my womanhood. And to please keep her in touch for educational mailing list. I just wanted to echo that sentiment. This was extremely informative and impactful, and we really appreciate your time. And this was such a necessary conversation for the South Asian community, but all women of color too. And, you know, this is just the beginning, and I hope to continue the conversation with you wonderful women.
Thank you. Thank you so much for having me.
Thank you. Have a great evening, and thanks to everyone for joining.
Bye.
Thank you.
Bye.
Bye.